Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about another electrolyte, that is chloride. We already know that these electrolytes are categorized as cations and anions. So electrolytes are nothing but electrically charged elements. So जो positive charge रहते हैं like sodium, potassium, calcium, magnesium, these are the cations. Move towards the cathode, and anions are chloride, bicarbonate, phosphorus, etc., which move towards the anode. You will see that this chloride is mainly present extracellularly compared to the intracellularly. So always this chloride will follow sodium. So the concentration of chloride also is more extracellular compared to intracellular. Potassium is more in the intracellular. Phosphorus is more intracellular. So what are the functions of this chloride? Remember, this chloride becomes very important in maintaining the electrical neutrality. This electrical neutrality is the one which will help in regulating the blood volume or the arterial pressure or buffer for acid base balance, etc. So this chloride has an inverse relationship with the bicarbonate. So whenever a bicarbonate moves inside the cell, the chloride, the negative charged ion chloride, will move out of the cell to maintain the electrical neutrality. And because ये chloride ये maintain करने की ताकत उसमें है, this will help in the management of the arterial pressure or the acid base buffering, etc. It also interacts with the sodium to maintain the osmotic pressure. So this chloride becomes very important in maintaining the osmotic pressure, in maintaining the acid base balance, in maintaining the blood volume, in maintaining the arterial pressure, etc. So this is chloride absorption and excretion. Kidney plays an important role in doing that, and you will see that around 70 to 80% of this sodium and chloride are reabsorbed by the proximal tubules, and loop of Henle around 20 to 25% are reabsorbed sodium and chloride, and the excess of chloride, whatever is there, that is excreted in the urine. So chloride, I've told you, it maintains the water distribution in the body. It is helpful in the osmotic pressure. It maintains the electrical neutrality, and also it helps in the anion cation balance. So remember, this sodium always follows the chloride. So as father like son. So whatever whenever there is a movement of sodium, the chloride will follow it. So similar, you will see that the functions or the conditions which causes hypo and hypernatremia would be similar to the one which is causing hypo and hyperchloremia. Chloride has an inverse relationship with bicarbonate. So whenever the bicarbonate enters the cell, bicarbonate is a negatively charged ion. Chloride will leave the cell. So it has an inverse relationship. So whenever the chloride level falls, for example, if there is a vomiting, diarrhea, etc., or there is a renal loss, bicarbonate reabsorption often increases proportionally because they have an inverse relationship, and whenever there is increased bicarbonate, it leads to metabolic alkalosis. So that will cause decreased chloride level in the serum. So this is an you can see this is an RBC wherein the carbon dioxide present here is combined with the water and form carbonic acid, and this forms H plus and HCO3. So this bicarbonate, once it goes out, chloride will come inside. So the chloride levels in the serum will decrease in metabolic alkalosis. So these are the normal levels of chloride in the serum. They vary in children, they vary in adults, and also the level of chloride varies in the urine, in the sweat, and in the CSF and saliva. But remember, the normal range of serum chloride would be anywhere between 95 to 105 milliequivalents per liter. So this is a normal range. We are worried when the chloride level goes less than 80 milliequivalents per liter, and when the chloride levels exceed more than 110 to 115 milliequivalents per liter. So the normal range of chloride is 98 to 105 milliequivalents per liter, or 98 to 105 millimoles per liter. So this is a normal value. Sodium around 135 to 145 milliequivalents per liter. Potassium is around 3.5 to 5 milliequivalents per liter. Calcium would be around 9 to 11 milligram per deciliter. So this is a normal electrolyte value which we have discussed for sodium, potassium, and this is chloride, 96 to 106 milliequivalents per liter. So now coming to hypochloremia. Hypochloremia is a condition when the chloride level in the serum is less than the normal range, less than 96 milliequivalents per liter. But we are more worried when the chloride level falls less than 80 milliequivalents per liter. So in the hydrochloric acid in the stomach, you know that it has chloride. So whenever there is a loss of hydrochloric acid in the form of diarrhea, in the form of loose motion, in the form of peptic ulcer disease, etc., there will be less of chloride. So the chloride loss can be because of gastrointestinal diseases or because of renal diseases. Gastrointestinal, like it could be vomiting, or it could be gastric fluid drainage, or there might be a high volume ileostomy drainage, etc., wherein there is loss of the chloride. And renal, because of the diuretics or because of certain syndromes like Bartter syndrome, Gitelman syndrome, etc., there might be loss of chloride from the kidneys. Suppose if there is an excessive water gain, for example, congestive cardiac failure, in case of syndrome of inappropriate antidiuretic hormone secretion. So when the level of when the volume increases compared to the chloride, the level of water gain is more, and that will cause hypochloremia. Other causes of hypochloremia may include metabolic disorders. I have told you in metabolic alkalosis. In metabolic alkalosis, what happens is the bicarbonate level will be more in the serum. So what happens? The chloride inside the serum comes inside the cell. So there will be hypochloremia because bicarbonate and chloride have an inverse relationship. I have told you GI suction, vomiting, diarrhea, there is loss of chloride. If you ingest alkaline substances, that will increase the bicarbonate level, and obviously the chloride level is going to go down. Renal disorders we have already discussed. Diuretics can increase the excretion of chloride in the urine. Hormonal influences I have told you already, SIADH. Hypervolemia, like in case of heart failure, cirrhosis, etc. When there is severe burns, there is oozing of all the electrolytes like sodium, potassium, chloride can be lost from these burn sites and can lead to hypochloremia. So what are the symptoms of hypochloremia? One is muscle weakness. Patient might feel very fatigued. He might have dehydration. There might be difficulty in breathing. There might be muscle twitching. There might be irritability, arrhythmia. There might be confusion. The blood pressure changes can be seen. There can be tingling and numbness in his finger and toes, and he might have an altered sensorium. So all these are the symptoms of low chloride level in the serum. Hyperchloremia. What is hyperchloremia? When the level of chloride exceeds the normal range. So what is the normal range? Around 96 to 106 milliequivalents per liter. But we are worried when the level of chloride exceeds more than 115 milliequivalents per liter. So that is called as hyperchloremia. So now what are the causes of hyperchloremia? One is dehydration. So whenever there is loss of water, that can concentrate the chloride in the blood. So that can also cause hyperchloremia. Kidney disease. Suppose if there is any acute or chronic kidney condition, that will not be able to regulate the chloride levels in the body. So it may not be able to excrete out the excess chloride, and the chloride level in the serum might start rising. So any acute or chronic kidney disease can cause hyperchloremia. If there is an excessive saline administration, if too much of saline is given during medical treatments, it can also increase the chloride level, because I've told you sodium will pull chloride also. So that can also increase the chloride level in the serum. And medication, certain diuretics or corticosteroids or carbonic anhydrase inhibitors can affect the chloride balance. If there is metabolic acidosis, like in case of severe diarrhea or renal tubular acidosis, they will lead to acid retention. And whenever there is an acid retention, there is bicarbonate loss. And when there is bicarbonate loss, increased chloride will be there in the serum, because bicarbonate and chloride have an inverse relationship. So this can cause to hyperchloremia or increased chloride level. Respiratory alkalosis. Whenever there is hyperventilation, the patient will have reduced carbon dioxide level. So that causes the chloride imbalance in respiratory alkalosis. So these are all the causes of hyperchloremia. It could be dehydration, kidney disease, excessive saline or salt intake, certain medications, metabolic acidosis, and respiratory alkalosis can cause hyperchloremia. So what are the symptoms of hyperchloremia? Patient may have again fatigue, muscle weakness, he might have excessive thirst, dry mucous membrane, his blood pressure might be high, patient might have an altered sensorium, he might be confused, lethargic, there might be difficulty in breathing. And suppose in certain conditions when the level has not risen so very high, the patient can be asymptomatic also, and we only detect hyperchloremia through blood test. So in respiratory alkalosis, the pH is going to rise, and because of hyperventilation or pain or anxiety, etc., the carbon dioxide level in the blood will go down. That will lead to increased pH, and as a compensatory mechanism, kidney will start excreting increased amount of bicarbonate to lower the pH. And when the bicarbonate is lost, the chloride level is going to rise. So this happens in respiratory alkalosis. So this is what I was telling you in acidosis and in alkalosis. So in acidosis, there is gain of carbon dioxide. There is more of acids in the blood. So the pH of the blood is going to go down. So the kidney will compensate. How it will compensate? It will conserve the bicarbonate, because it wants to increase the pH of blood. So whenever it is trying to conserve the bicarbonate, definitely the chloride level has to go down. If there is increased bicarbonate, the chloride level will be less. So there will be hypochloremia. And in alkalosis, what happens? There is loss of carbon dioxide. Hyperventilation, patient cannot retain carbon dioxide. So there is loss of carbon dioxide. Alkalosis, the pH is going to rise. As a compensatory mechanism, the kidney doesn't want bicarbonate, so it will try to excrete the bicarbonate, and when the bicarbonate levels are decreasing, the chloride levels will be increasing. That is about chloride, its normal ranges, the causes of low and high chloride levels in the blood, along with its symptoms. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.